My bones feel like they're being crushed from the inside. Instead of my red blood cells being round and squishy, mine are actually hard and shaped like a letter C. 17 million people globally live with sickle cell disease. The scientific research, the treatment, the knowledge is very limited. My name is Janika Leah, and I want to change that. I've had so many complications just because of sickle cell. We need to acknowledge the scale of this disease and give it the attention needed. Sickle cell predominantly affects Black people. Did you know? Because it doesn't get much attention. I want to change the way people see sickle cell. Doctors, researchers, fundraisers, pharma. I want people to pay attention. I want to make the invisible visible.
Good afternoon, welcome back, good evening for those that are online abroad. It's a pleasure to be with you today, and I hope you had a great lunch and set of great discussions with the management and of course between you. My name is Ludovic Helfgott, and I will have the pleasure to walk you through what Novo Nordisk is doing in terms of rare disease. I would like to start a bit where we left together a couple of years ago when we did the last CMD, and I would like to frame a little bit what Novo Nordisk is doing from a rare disease perspective and why we are investigating in this area. Let me start with the most important, the unmet need. Right now, today, you have roughly between 8,000 and 9,000 rare diseases in the world, out of which 95% of them don't have a proper cure. It's reduced life expectancy, severe comorbidities, and impaired quality of life, long diagnostic lead times, and of course, broken continuum of care. We need to do something here. It's also part of our purpose. And in that frame, Novo Nordisk has a long-standing legacy in terms of rare disease in two aspects particularly. First, on the growth hormone side, since the early 70s when the investigation started. And of course, in hemophilia, since the early 80s with the Novo 7 first, but then all the subsequent treatments that are now helping our patients, Esperoct in hemophilia A, Refixia Ribaline in hemophilia B. So there's a need, there's a frame, there's a legitimacy. Second, we really believe that rare disease constitutes an amazing opportunity for Novo Nordisk for three reasons. Reason number one is the strategic portfolio play. When you look at the overall portfolio of Novo Nordisk, a lot of prevalent, highly prevalent disease, and we saw that this morning. Here we have a very specialistic play. Few patients, huge unmet needs, very specialized healthcare base, with physicians being both investigators and clinicians, and very specialized frontline teams on the commercial side, on the medical side. A complete different business model, so very helpful from a strategic perspective. It's also a platform to spearhead new trends. As we heard this morning, with rare disease, Novo Nordisk is working on new therapeutic platforms like gene editing that we are really spearheading for the whole company. Innovative access pathways, of course, with early access schemes that are multiplying across the globe, not just in the US, not just in Europe, but also in China, for example. And of course, new operating models where we can actually cluster some centers together. And doing this by focusing not on the medicine, but on the solution around the medicine. What we call 5D, which stands for Digital Diagnostic Device, Drug and Data, is actually a turnkey solution that is now important in the rare disease world, was actually important already 15 years ago in the oncology world, and we believe will play a key role going forward, even in the prevalent diseases. Last but not least, it's an integrated unit, mostly dedicated to rare disease, from early research down to commercial, that is really able to work in a nimble and flexible way. So that's why we believe it's a good opportunity. When we saw each other last time, we were at the beginning of this adventure. And we spent the last few years really building our rare disease strategy. That is based on three pillars. First pillar, serve more. And by serve more, I mean what are the areas, the disease areas in which we need to focus. As I mentioned, 9,000 rare diseases. It's very easy to get lost. It's very easy to get lost in the maze of rare diseases. So where do you pick your battles? And we decided to move from hemophilia to rare blood disorders, and from growth disorders to rare endocrine, because these are the two places where there is a high growth over the coming years, but also are we legitimate, because we have the biology and we have the platforms. The second pillar is find more. And this is very, very important again, because find more means two things. It means one, we are actually allowed to pick in the best technology platforms that Novo Nordisk has to offer. Of course, the historical peptides and proteins, but also, as you can imagine, silencing RNA, and we've just launched nedosiran with Floza in the US, gene editing I mentioned, and small molecules, for instance, with the acquisition of Pharma Therapeutics last year. It also means that we need to grow on both legs, both internal and external. So it's very important to grow on both dimensions. And last but not least, the third pillar is grow more. Because if we are very competitive in diabetes and obesity, we need to be equally competitive when we're talking about rare disease. There's no reason why patient share and market share are not valid. And I'll share with you examples about that a bit later. This trajectory was built on 3 episodes. The first one was from 2019 to essentially 2022. We had to relaunch the search engine and really maximize the value of the existing brands. The second step in this journey is a step where we're going to launch the new medicines that we are just bringing to patients today. And of course, we're talking all hemo in hemophilia A and B with inhibitors. So Groya in growth disorders, Refloza, rare hematorenal disease, hyperoxaluria, just launched recently in the US. And of course, the one you're all expecting, I guess, Mymate. We will talk about a little bit later. At the end of the decade, we'll be talking much more about the expansions towards hemoglobinopathy, sickle cell disease, and thalassemia as an example. So let's quickly get through the first pillar, serve more. And I mentioned to you that the point was here to find the right balance between fully leveraging our experience and the logical adjacencies with our core areas like hemophilia and growth disorders, but not spreading ourselves too thin. And this is why we came with that approach. We call it the sunshine, the rare disease sunshine, where you can see that by focusing on rare blood and rare endocrine disorders, we've decided to focus on a few disease areas where we believe that the depth of our portfolio will be very important, and our platforms as well. Out of the sort of 350 million patients suffering from rare disease in the world, this is only 6%. 6%. So it could seem wide, it's actually very focused when you think about it. And we're focusing on 3 elements to start with, the beginning, the core, the foundation. The first one is, of course, the rare bleeding disorders, hemophilia, Glanzmann's, on which we've been already very present, huge unmet need, very attractive growth over the next decade, new technologies coming in, including gene editing, but not just, and we have here, with Mymate, a key card to play. Hemoglobinopathies, the second one, in the blood side, sickle cell disease, thalassemia, and this is really an important one. We barely talk about it, but essentially, if you have sickle cell disease, your life expectancy is reduced by 25 years. 25 years less than the average, okay? It was around a bit more than 20 in the early 80s. We're now around 40 today. It's a massive unmet need. And on this one, we actually are developing a portfolio in research and in development to help us tackle what we believe will be a very growing category. Last but not least, the growth disorders, the one we are already on. We used to be with norditropin, and we're now entering with the long-acting growth segment with Sogroya. And let me now move to the second pillar of the strategy, and you've heard a lot about Martin's darlings this morning with Emmeline. He's going to talk to you a bit more about the other darlings of Martin. So what's in the pipeline of rare disease, Martin?
Thank you very much. And Ludovic is exactly right. I have 3 kids. I love them all, and I can love more than one drug. So obviously, moving into the rare disease space, I also have my darlings. Ludovic already talked about this. In rare disease, broadly speaking, the unmet need is incredibly high. We still see unmet need in rare endocrine disorders. We still see unmet needs in rare blood disorders. From a research, but also from a development perspective, what we do is to think about how do we create synergies. By allowing ourselves to stay, for example, within rare endocrine and doing research and external innovation in that space, we can already now see in the preclinical pipeline stuff coming in from Marcus that will be very exciting. We do the same thing in the rare blood disorder space. We've been many years in the hemophilia space, but building on the synergies, the capabilities that we have in research, in development, but also in the commercial space, allows us to successfully build and progress a pipeline. So if we moved from hemophilia to now also focusing on hemoglobinopathies, Ludovic talked about sickle cell disease, huge unmet need, not only in terms of decreased life expectancy, but a life in pain, a life with comorbidities, and really a huge unmet need. Rare disease from a research and development perspective is also an area where we can allow ourselves to experiment, both in terms of how we do research. You actually see more technologies applied, including gene editing, in this space than what we do in the diabetes and obesity space so far. Actually, as Marcus also alluded to, there is a potential of also using some of these technologies in our broader disease areas, but we can maybe start out testing and learning in the rare disease space. In the development space, we do the same. MyMate is a good example of that. It's one of the fastest full development programs that we conducted in the development space, 4 years from first human dose to end of phase 3. So right now in the rare endocrine space, from a clinical perspective, we are investigating new indications for Sogroya. That is incredibly important. Big unmet needs in those spaces. In the rare blood disorder space, you see actually a quite broad pipeline focusing on not only hemophilia, but now also sickle cell disease and thalassemia. I also have to mention, while it's not in the slide, nedosiran, our first siRNA approved drug for the treatment of primary hyperoxaluria. In this slide, I want to call out, obviously, MyMate. I'll do a little bit of a deep dive in MyMate, but I do also just want to call out etavopivat. Talked about the huge unmet need in sickle cell disease. Etavopivat is an externally acquired molecule, and we are very excited about that. When doing development in rare disease, I talked about the speed with which we have progressed MyMate, but you also have to do innovation in terms of trial design. You don't have a lot of patients to put into clinical trials, and therefore you have to get the best out of everything that you do. So the Frontier 2 trial is a reasonably complex trial. It's not the biggest trial in the world, but we are investigating patients coming from on-demand treatment, investigating patients coming from prophylaxis treatment, investigating once weekly and once monthly dosing. MyMate has the potential to be best in class. Obviously, we have to show that in phase 3. And no, I have not seen the data. They will come soon. I have not seen the data. But the potential of MyMate based on phase 2 is that it could have best efficacy. So obviously, median annual bleed rate of 0, that is to be expected. But in opposition to what we already see out there in the market, MyMate has the potential of having 0 bleeds in more than 70% of the patients. Obviously, again, I have to show that in phase 3. It has the potential to be very safe, but also a clear differentiation on convenience. So truly once monthly in an easy to use device, subcutaneous injections in low volume and therefore pain-free. Also on the convenience side, an important differentiator. And therefore I think Ludovic can work hopefully a lot with that.
Thank you very much, Martin. And I would love to quickly finish by the third pillar. We said, find more, serve more, find more, and now let's grow more. And you're going to start by saying, well, grow more. What happened last year? And I think it's a very fair question. If you look at our growth pattern since 2020, we actually grew in 20, in 21, in spite of course, the pressure on Novo 7, and in 22, plus 1%, and we decreased in 2023. And that essentially is due to a product supply and manufacturing output crisis that we had by changing an old factory to a new factory while the demand was actually going extremely fast. And that actually created some disruption from a PS perspective, from an output perspective, mostly on the endocrine side, and we hope that the whole production will be stabilized during the course of 2024. The point, though, is that growing, of course, relies on commercial. And I would like to spend a bit of time on what has not been affected by the Norditropin issue last year. It's actually the blood franchise. And you can see that actually on the left-hand side of this slide, where in the hemophilia B segment, we were able to double our market share in only 1 year. If you look at our latest launches in terms of EHL, extended half-life, the combined growth here is above 30% growth, even 4 years into the launch. So it's really something which is quite impressive, and that's a tribute to the teams of Doug and Mike. On the right-hand side, something very interesting. Sogroya, new long-acting growth hormone. We launched at the beginning of the summer in the US. In less than 6 months, we're the third entrant on the market. We're now the number one. We have actually 6-point-something market share. At the end of the period, we're already number one. And if you look at Japan, if I'm not mistaken, we're also around 8% by the end of the year. So as you can see, the commercial engine behind is actually very healthy. And this is why we're so really confident about the promises to capture the fair share of the rare disease market. So as a conclusion, strategy is unchanged, focusing on rare blood and rare endocrine, a dedicated rare disease unit with early and late pipeline and launch capabilities to really capture growth. And last but not least, the MyMate results, phase 3 results expected in the first half. And if everything's fine, we might have a couple of other opportunities to talk about this later in the year. Thank you.